Now it's time for TIPisodes with quick tips you should know. Techniques you can implement into your workflow right here on A Tale, oh yeah, A Tale of Two Hygienists.
Hi, this is Stephanie Botts, practicing dental hygienist and ergonomic specialist. Today's TIPisode is sponsored by Zerk Dental Products. I'm excited to share with you today not only some ergonomic tips that can help you while you work, but also how some of Zerk's products fit into practicing ergonomically as well. So again, thank you, Zerk, for your generous sponsorship of today's TIPisode. Dental hygienists have so much to think about during the day and during each appointment they have. Sometimes we're just in survival mode, right? We're trying to stay on time, trying to keep our patients happy and comfortable, all while providing a really high level of care. Because of this, often we aren't thinking of ourselves or caring for our bodies while we're in the operatory, but that is something that I would like to highlight today. We cannot give this high level of service or really even stay in the profession if we aren't caring for our bodies. So we're going to be talking about repetitive strain injuries today and how to prevent those when it comes to using our suction. Also, stay tuned for the end of the episode as there is a special gift at the end for listeners. There's nothing I care about more than the health of clinicians. We cannot do our job or enjoy our life if we're in pain. That's why I got into ergonomics. I want to help clinicians discover ways to help themselves while also helping their patients. Our job as dental hygienists is highly repetitive, as we all know. So that's the very reason why we develop repetitive strain injuries. What is a repetitive strain injury? So the definition is the gradual buildup of damage to muscles, nerves, and tendons from repetitive motions. So just think about your job as a dental hygienist and how repetitive everything we do is. We're constantly holding on to something, right? Whether it be our instruments, our suction, our air water. Eventually, holding on to things, especially with the death grip, which a lot of us do, all of these motions over time will cause injury if we're not acting proactively. So some of these common injuries are these repetitive strain injuries, our carpal tunnel syndrome, that's still the number one amongst dental hygienists. Then we have bursitis or rotator cuff injuries or tennis elbow or any kind of tendinitis. And in most cases, these injuries are preventable unless you have some kind of pre-existing injury or damage from something that happened before. So these injuries, these carpal tunnel or bursitis or tendinitis, these are the things that take us out of the profession as dental hygienists. So we've got to start acting proactively now to prevent injuries like this. While these injuries are common in dental hygienists, let's not confuse common with normal. It is not normal to be in pain or have a reduced range of motion because of practicing hygiene. However, there are behavioral habits and products out there that can help protect us from this. So I want to focus on one aspect of all of this today, which is how we use our suction while we're using our power instrumentation. As an ergonomics coach, I'm frequently visiting offices and coaching hygienists. And I oftentimes notice that they're using their power scaler in one hand and holding either the HVE or the saliva ejector in the other. So this isn't ideal for a couple reasons. I'm big on clinicians using their indirect vision to maintain their ergonomics and their neutral posture and visualization, but we can't use our mirror if we're holding on to the suction. We could also be retracting when holding on to the suction, and this causes a couple things. When we're retracting and holding on to the suction, it causes something called contact stress and increased pinch force. Both of these will increase the risk of our injury over time. So pinch force is that force needed to hold on to an item. And a lot of us in dental hygiene are holding things with way too much pinch force. Okay, you want to hold on to something with as little pressure as possible to actually hold on to whatever it is you're trying to hold on to. Contact stress is the pressure between two objects. So if you're providing retraction with the suction, you've got contact stress between your suction and the cheek or the tongue. And sometimes, I don't have to tell you this, patients can have very strong cheeks or very strong tongues. And so if we're trying to retract those with our flimsy saliva ejector, it's not going to be effective. And we're going to be using a lot of pinch force, which really causes fatigue and injury over time. This fatigue from holding onto the suction for 30 or 40 minutes or however long, it will add up at the end of the day or week or month or year and will negatively affect you over time. So there are some solutions for this. Some hands-free suction solutions that I would like to talk about from Zerk. This can really help us when we're using our power instrumentation. Again, I advise clinicians to use a hands-free suction option so that they can use their mirror, which helps maintain proper ergonomics and neutral posture. So Zerk has 2 items that can help with this, Mr. Thirsty and their pink petal. So let's talk about Mr. Thirsty first. So this is a hands-free suction device. It plugs directly into any HVE valve, so you don't need any extra equipment or attachments in order to use this. But Mr. Thirsty provides comfortable isolation and retraction for your patient. And what I like about this is it's really customizable. So they have a lot of different sizes already, but then you could take that a step further and trim the sides down if you have a patient that maybe has a really narrow jaw, if they have large tori, or if they're a gagger. Another thing I really like about their Mr. Thirsty system is how lightweight their comfort kit is. So there's a lot of suction devices out there, and I don't know if you've noticed, but sometimes when you're using one of these, the weight of that HVE cord can really pull on the patient and make it uncomfortable for them, or can cause some jaw fatigue, which will make our jobs much harder. So their Mr. Thirsty comfort kit has much lighter tubing, so you don't have as much of this pull. It also has a built-in bite block, which I really like. So you plug Mr. Thirsty into the patient's mouth. The patient is able to comfortably relax down on the bite block. You don't have to worry about suction. You don't have to worry about repositioning the device. You're able to freely see half of the mouth at a time. So you're really only just doing one adjustment. This is so much better than constantly having to reposition your device because, again, we're trying to reduce our repetitive motions over time. Mr. Thirsty is also disposable, which really limits the risk of cross-contamination as well. Another option for hands-free suction is their pink petal. So this is a very simple attachment that goes onto the saliva ejector. And again, this provides hands-free suction and is very comfortable for the patient. So I don't know if you guys have done this. I've done this a lot, where you hook the saliva ejector into the patient's mouth. You're trying to balance it maybe on the posterior teeth. The saliva ejector never stays put. It's constantly moving around, which makes you constantly adjusting it. And if it gets stuck on the patient's soft tissue, it can cause tissue trauma as well. So the pink petal is a really nice option. It keeps the saliva ejector put, and it doesn't cause any tissue trauma to the patient. So as for the surprise that I mentioned at the beginning of the episode, Zerk is offering free samples of their Mr. Thirsty system to listeners of today's TIPisode. So please visit the link in the show notes to get your free samples. Also, I wanted to mention we're recording this in July, which is also the month of RDH Under One Roof. So Zerk will be there. They're at booth 323. They always have really fun, exciting booths, so please stop by and say hi and see the rest of their amazing products. They really do have a lot of great products that can help dental professionals practice safer and more efficiently. So we all know that patient comfort is important, not only to put them at ease, but it helps us as well, because the more comfortable and relaxed our patient is, the more compliant they will be with us when it comes to positioning them or moving them around in the chair. If they have options like what Zerk offers with their Mr. Thirsty or their pink petal, that goes a long way of helping us with our ergonomics and also helps our patients feel more comfortable in our chair. For more information about myself and my company Posture Pros, please visit my website at posturepros.net, and also links for any of my social media profiles will be linked in the show notes.
A tale of two hygienists.